the disability community is, of course, not a monolithic community. But what is true is every single major national or disability rights organization that has taken a position on the issue of physician-assisted suicide opposes the legalization. Every single one who's taken an issue, taken a position on this issue, opposes. Now, Compassion and Choices, which was, as Carrie noted, the Hemlock Society before, has put one of their former directors, is now the executive director of a small organization in California, and she's filing legal briefs in New Mexico where they're trying to legalize physician-assisted suicide through a court case. And they're trying to say, oh, but they're a major disability rights organization. They're not. And certainly not within the disability rights legal organization of which I've been a part of for 20 years. They've never been a big player in that regard and continue to not be. And partly because they ignore the will of our community. And our position is that if assisted suicide, physician-assisted suicide is legalized, mistakes will be made and people's lives will be lost through coercion and abuse and mistakes. Undoubtedly. These laws, and you'll see when in the language of the ballot initiative, we're talking about people who are dying, they say. They're not. This is not about people who are dying. These are talking about people who have a terminal condition, which are many of us. I'm sitting here as a person who qualifies under every version of any version of these laws that have been proposed in any state. I have a type of muscular dystrophy, and without life support, I would not be here. And without my ventilator, I wouldn't have months to live, I wouldn't have weeks to live, I would have hours. And I'm a person who's sitting here who qualifies under this law, and I could become depressed. I could have any of the things occur to me that could happen to any middle-aged woman. Something could happen to one of my children, my law practice could fall apart, I could lose my house, my cat could die, any number of things. My parents could pass away. I could become depressed. And I'm a smart person. I could go to a doctor, and because I have to rely on Medicaid for home health so I have to have Medicaid for my primary insurance, I'm stuck going to the doctor that happens to take Medicaid at that time. And because we frequently have budget cuts, the pool of doctors is ever shrinking. So I could be stuck going to a doctor that I don't know. Or because I have Medicaid, I could just go to a doctor I don't know. And I could talk about how horrible my life is and how I would no longer want to continue living with the level of disability that I have. And because the medical establishment devalues disabled lives, I would likely walk away with a lethal prescription instead of the mental health care I would so desperately need in those moments. As an example of why and how the medical establishment devalues our lives, I have a 25-year-old daughter who has a severe intellectual disability and physical disabilities. Last fall, she had an appointment to get a couple teeth extracted, and it had to be done under anesthesia. And I'm sure as most of the college students here have had their wisdom teeth pulled, you far prefer to have that under anesthesia. She went in for this tooth extraction at the hospital. And I was asked, does she have a do not resuscitate order? Now, I dare say most young adults having teeth pulled are not asked if they have a do not resuscitate order. On the other hand, it was in a hospital, so it's not an entirely uncommon question, but still not something asked of most 25-year-olds. So I said, no, she does not. I was then asked, do you want one? And I looked at the woman. I'm looking at my daughter sitting here who's healthy, disabled, but healthy. And I think I probably gave her a look like she just grew horns and had snakes sprouting from her ears or something. But she asked again, are you sure? When I said I did not want one. Yes, I'm sure. That's how little her life is valued as a woman with a severe intellectual disability. And under the proposed Initiative 100, because she does not have a guardian, I could orchestrate a medical power of attorney for her to sign that includes the right to give her a lethal injection which is what they are asking for in Initiative 100. And she could be murdered in that way, and having never asked for it. That's involuntary euthanasia. And that's what Initiative 100 allows. And that's what, and we see the slippery slope in effect here in Colorado already. We have 2 ballot initiatives proposed. One to legalize assisted suicide, which also has a mechanism to allow euthanasia. And I'll get to that in a little bit when we start talking about what does self-administration really mean. And then we have Initiative 100, which proposes to allow euthanasia by lethal injection. The proponent of this bill got up and testified before the Legislative Council about how he envisions death clinics. Kind of like we have medical marijuana doctors to give you a medical marijuana prescription, he envisions death clinics where you can go get your lethal injection. And this is not restricted to just physicians. This can be any medical professional. A CNA could open a practice to administer a lethal prescription. And that would be allowed under this law. A podiatrist, a chiropractor, a doctor, a nurse practitioner, a pharmacist could all open clinics, open death clinics under Initiative 100. And coercion and abuse will happen under both of these laws, whether it occurs through the legislature or whether it occurs through some sort of ballot initiative. We've seen it in Oregon. The proponents of these initiatives, Compassion and Choices, frequently says, there are no reported instances of abuse in Oregon. That's because there's no reporting of any substance at all. Of course there's no reported abuse because they don't collect any statistics that would allow anyone to uncover abuse. And even if the limited statistics that they collect did allow someone to study it and find it, they can't because they destroy those statistics after they issue their redacted reports of summary statistics. So nobody can even go in and study what's happening. Scholars can't do it. Lawyers can't do it. Doctors can't do it. Nobody can go in and find out what's happening in Oregon. And what we would have in Colorado is even less information because there's no data collection at all. And the laws here require doctors and coroners to put misinformation on death certificates. Requires the death certificates to say the person died of whatever the underlying condition is. And that underlying condition under all of these laws could be something as simple as insulin-dependent diabetes. Without insulin, you're going to die within 6 months, undoubtedly, which means you qualify for these laws. There are lots of conditions that without treatment could result in death in 6 months or less. That's the more conservative bill. That's Initiative 124. Would allow somebody with type 1 diabetes to access a lethal prescription. These are not people who are dying. These are people who have years and decades, scores of decades to live. People who could live 50, 60, 70 more years with medical treatment that could access a lethal prescription. And part of the reason why our community is so concerned is we see what happens when profits drive healthcare decisions. It would be easier to get a lethal prescription than a wheelchair, than a properly fitting wheelchair. And that's the case in Oregon and Washington and Vermont today. It is far easier to get a lethal prescription than a properly fitting wheelchair. And way easier than trying to get a van with a lift or a ramp to your house, for which there's very few public funding sources to help people with that.
But the state will pay for it in Oregon.
But in Oregon, you can get this, and Washington, the state will pay for a lethal prescription. And we've seen that happen. We've seen it happen. Two widely reported cases, that of Barbara Wagner and Randy Stroop, are two individuals who had cancer, who wanted to access 2 forms of chemotherapy, treatments that are today common. Not as common at the time they were trying to access them a couple of years ago, but because of the nature of advances in cancer care, what treatments that are available today may not have been available even 3 and 4 years ago. And they now target treatments based upon the exact genetic footprint of a specific cancer, as was the case with Barbara Wagner. Medicaid in Oregon would not pay for their chemotherapy, but each of them got a letter saying, but we will pay for lethal prescription. That is not a free choice, that's coercion. That's not a real choice. And when the proponents talk about choice, people have the choice. Well, I don't want to see anyone commit suicide. Everybody has that choice to make that happen. You do not need to involve our medical system, and you certainly don't need to involve the government in doing so, which is why I'm so flummoxed by the number of libertarians who support physician-assisted suicide, because what they're supporting is not individual choice. They're promoting the government being involved in their individual choice, which seems against everything I know about libertarianism. And this is not, we view this not as a conservative issue or a progressive issue. This is an issue of social justice from our perspective. Because while certainly there truly are a handful of people for whom palliative care does not work, who do die in pain, who have very difficult deaths, undoubtedly. And a very small percentage of even that very small percentage could potentially benefit from this bill. The risk of harm to the larger society is so great that our community is quite united in opposing a physician-assisted suicide, because this so-called treatment will become the default. I use a ventilator that costs thousands of dollars per month. It would be far cheaper to give me a $300 lethal prescription than to pay for even a week of my ventilator. And when some bean counter in an office, some underwriter for an insurance company is making those life and death decisions, I'm not going to come out ahead. My kids are not going to come out ahead, and my community won't come out ahead. And the safeguards, the so-called safeguards in these bills, do not protect people. They're worthless. First of all, let's talk self-administration. Initiative 124 and the proposed bills at the Colorado legislature talk about self-administration. Well, when you start looking at that, and you start looking, if somebody ever were to go to court on this issue, you start looking at how the term is used in regular medical practice. Everybody in this room has probably self-administered a medication to somebody else. But maybe not some of you younger folks who don't have kids yet, but anybody who's had kids has self-administered medication to their children. You've given your kids Tylenol or aspirin or ibuprofen when they're sick. You've given your family members the medication after surgery. You've given your family members medication when they've been prescribed antibiotics. And anyone who's had children has done this. Anybody who's in a caregiving role to any adult has done this, because that's self-administration. That's not administration by a doctor or a nurse. That's individual giving themselves the medication. And in ordinary use, that involves me giving my kids medication. That would involve me giving, say, an elderly parent medication or my ailing spouse medication. And that would all be covered under Initiative 124. So the proponents keep saying, oh no, this isn't for people who can't take the medication themselves, yet they trot out story after story after story of people who have ALS, which is a neuromuscular disease similar to what I have, where people have lost hand and arm function, have lost the ability to swallow. Those are the stories they're trying to use to sell this to the public. And yet they try to go under the guise that this is self-administration when they know that's not truthful, because they absolutely intend for this bill to apply to those folks. In fact, one of the people who are proponents of this bill, one of the people who have sponsored both versions of the assisted suicide bill in front of the title board, is a woman whose father's story was in the Denver Post, who had ALS, who begged for the right for assisted suicide, for physician-assisted suicide. And you can betcha she's not advocating for a bill her father could not have used. She's advocating for a bill that she knows her father could have used, because self-administration means nothing. That's not a safeguard. And when somebody else gives the medication to their loved one or their not loved one, that's euthanasia, and that's what we're talking about. There are no witnesses required at the time of death. So I'm somebody, my attendants help prepare my medications. They put them in syringes, and while I give my medications to myself, I don't watch what they put in the syringes for me to put in my G-tube. I don't watch them put them together. So if I got that lethal prescription and I decided not to use it, there's nothing stopping one of my attendants from, say, taking that medication and putting it in the syringe and handing it to me with my other meds. I'd never know. There are no safeguards to prevent that from happening. There are no safeguards to prevent somebody from putting the medicine in grandma's applesauce and feeding it to her, and she would never know. Because there's no witnesses at the time of death in these bills. There's no way to ensure that this was a voluntary decision on the part of the person who had the prescription. There's no control over who's doing the helping. And because of that, these present great risks, particularly to elders. Particularly middle class and upper middle class elders who have estates that people can benefit from. Those are the people who are most at risk from these bills. Because people do have impatient heirs. People do have exhausted caregivers. And honestly, people do ask. People do say at the end of life, please help me die. Anybody who's worked in hospice and worked with people who are dying have heard people say that. But that's not who's going to be harmed by this bill. Those people who truly are at the very end stages of life. That is the very tiny population that could potentially be helped. But meanwhile, the number of people who could be harmed is great. And so that's why our community is steadfast in our opposition to this bill.